on the board and associate members, and 1.5 minutes for observers, representatives of UN agencies, United Nations, and other international organizations, and the non-state actors in official relations with WHO. The same as non-EB member states, but to their core missions. I would like to encourage also NSAs with similar areas of technical interest and expertise to provide joint statements. Second change this time is PBAC. PBAC at its meeting last week played a more active role. When we take up the items that PBAC considered on its agenda last week, I will ask PBAC Chair to report on the specific recommendations and guidance proposed by the committee. In this way, we can focus on our discussion on the PBAC report and decide whether we concur with PBAC's recommendation and proposed guidance, rather than having another full discussion of each of the documents, which already benefited from an in-depth discussion last week. In this way, we will consider for each item already considered by PBAC whether to accept the recommendation to note the report and any other specific recommendation of PBAC, and whether we concur with proposed guidance provided by the PBAC. The proposed guidance reflects broad consensus of the PBAC. If we concur with it, then Secretariat should take the guidance into account in implementing its mandates. These elements will be guide Secretariat in its work and will be duly reflected in the report of governing bodies under existing mandates. I wish to discourage, as I said, due to a short interval of board and the White House Assembly and short White House Assembly, I would like to discourage as much as possible intersessional work, which may be requested in order to build consensus on draft resolution decisions which were not agreed during EB 146. It is because, as said, the interval is too short. So that is a package of change of sort of reforms which I would like to introduce at this session on trial basis. So may I take whether you have any advice, whether we can go ahead with these directions? If you have any advice, please say so. Floor is open for board members. I see none. Therefore, may I take that my proposals are accepted. Is it right? So I see no objection. So it's so accepted. Let us now review the plenary daily timetable contained in documents EB 146/div/2. Today, after our consideration of item 3, report of the Director General, we will turn to item 4, report of the Program Budget and Administration Committee. The PBAC Chair will present a high-level report of the meeting, because he is going to come back again tomorrow to introduce by each PBAC discussed items, so that we can build discussion on the basis of PBAC recommendation and proposed guidance. And also, what PBAC did is that is all the items relevant to PBAC, and these include all the budget and finance management and governance and human resource items covered by PBAC, as well as item 24, committees of the board, which include item 24.1, membership of the IEOSC, and item 24.2, participation in the PBAC. After discussing item 4, we will turn to item 5, report of the regional committees to the executive board, and each of the regional directors will be given the floor to present their report. When we convene at 2:30 in this afternoon, in other words, 14:30 hours, we'll turn to item 25, staffing matters. We will consider together item 25.1 and 25.2, appointment of the regional director for Africa and appointment of the regional director for Europe. As you may recall, appointments of regional directors are held initially in a private meeting and then in a public meeting. I'd like to remind you that private meeting is held in compliance with Rule 7 of the Rule of Procedure of the Executive Board, which means that the members of the board, their alternates, and advisors can attend. The member states not represented on the board and associate members can send one representative each without right to participate, and that secretariat attendance will be limited to the essential staff only, and that no official records shall be made. I would like to mention that the seating in the room has to be reorganized for the private meeting. Representatives of member states who are not members of the board will be requested to take their documents and personal belongings with them when they leave the room at the end of this morning session. After consideration of item 25.1 and 25.2, we will proceed to consider item 24.4, Nelson Mandela Award for Health Promotion. Up to this, we need to complete this because Mandela Health Prize Committee may be organized quite soon. So we need to agree or disagree up to here. And then, it is hopeful that if we go to pillar 1 at the end of the day, the first one is agenda item 6, primary health care. I would like to propose that we include in the discussion the document EV 146/38 at 1, containing the review of 40 years of primary health care implementation at country levels. When we turn to budget and finance matters under Pillar 4 and take up item 21.2, financing implementation of program budget 2018-19 and outlook of financing of the program budget 2020-21, I propose that we include EV 146/29 WHO resource mobilization strategy, which is closely relating to the outlook on financing of the current program budget. These issues are also discussed together with the PBAC. Similarly, when we return to item 22.2, engagement with non-state actors, I propose that we include documents EB 146/38 at 2, containing the initial evaluation of the framework of engagement with non-state actors. During the PBAC, the report was also taken up under the item engagement with non-state actors. On Thursday, I propose that we take up item 50.1 and 52.2 first, and as I said, begin with the morning session with coronavirus updates. Do I take the board is agreeable for the proposals? I see no objection, so decided. Now, a little bit of housekeeping related issue. I propose the board meet in the morning from 9 to 12:30, 9 to 12:30 for 3.5 hours. And in the afternoon from 2:30 to 5:30 for 3 hours. That is every day 6.5 hours. 6 days is 39 hours. Okay. And the evening sessions have already been planned for Wednesday and Thursday. That is when? That is 6 to 9? So working hours of Wednesday and Thursday is working hours is from 6 o'clock? 6 o'clock to 9 o'clock. So 2 days is 6 hours. So we have day working hours, 39, plus evening working hours, 6, that is 45 hours. So I call it 45 hours marathon. So thank you for joining this. As needed, we also had extended sessions as needed to complete our work. But please recall the decision, EV 145-6, in which the Executive Board decided that the session of the Board should close no later than Saturday, 8 February 2020. So that is already we have the decision. Do I take that the Board agrees with the timetable? Is all right? Thank you. It is so agreed. Now let us turn to a few other aspects on the participation in the Board. Regarding the participation of member states not represented on the Executive Board, in compliance of the Rule 3 of Rule of Procedures, all member states not represented on the Board and all associate members may designate a representative who shall have the right to participate without vote in the deliberation of meetings of Board. Such representatives shall have the right to speak after a member of the Board. Also, they can make proposals and amendments to proposals which shall be considered by the Board only if seconded by a Board member. So that is important. So non-EB members' proposals will be considered only when it is supported by one of Board member. And also, right of reply will be granted. Those represented may express their wish to take the floor, similarly as EB member, to raise your country nameplates. Representatives of international governmental organizations wishing to speak are asked to notify the Secretariat before the beginning of the item concerned by giving their organization name and title to Dr. Timothy Armstrong here, Director of the Department of Governing Bodies. Representatives or non-state actors in official relations are asked, as per the information note provided by your invitation, to contact with the unit of due diligence and non-state actors as early as possible for assistance when inscription on the list of speakers. When delivering statements, I would like to remind you that the delegates should speak a moderate speed that allows for the interpretation colleagues here, thank you, to ensure the message is conveyed clearly and accurately. Please send a copy of your written statements in advance to the email address interpret@who.int. Or if you have a hard copy, kindly hand it to the Secretariat at the back of the room. This does not prevent you from making adjustment on delivery, but will certainly facilitate clarity and accuracy in all languages. If you like your statement to be posted on the IEB website, or if you have a longer statement with information you would like to share additionally, you may send it to the email address statements@who.int. Please note that statement will not be included in the summary record of the meeting. With respect to a proposal for draft resolutions and decisions, I understand that several informal consultation has been already on, and more will be held on the margin of this AB 146. The scheduled consultation will be posted each day on the front of the program of work. The deadline of submitting draft resolution decision, this is very important. Deadline of submitting draft resolution and deadline is today, according to the rule of procedures. Deadline is today at 6 o'clock in the evening. These should be submitted in writing or sent by email to HG governing bodies @who.int. So deadline, please observe. Let us now turn to meetings of committees which will meet during our sessions. Details of meetings of the PRICE and the Foundation panels, which will take place on Monday the 3rd, Tuesday the 4th, and Wednesday the 5th of February, can be found in the preliminary timetables contained in document AV 106/2. This concludes our consideration of agenda item 2. So far, it takes 15 minutes and did 2 agendas. So we have 6.5 agenda. So we can do 12 agenda today. So we have 50 agendas. So we can finish in 4 days. But it is too optimistic. We have many agenda which we deserve good discussion. So one thing I would like to request that to maximize time, let's keep our time quite accurately. So I come from a country when Japanese train said starting 9, which means 9. So we start meeting from 9, and for a journey time, as I said, is 45 hours. And the stop or is 50 or 58, some counting measures. And we go with the spirit of no one left behind, so no agenda left behind. So, and before moving to the next item, I would like to seek your help in several technical issues. On mobile phones. During sessions of the board, you are kindly asked to switch your mobile phones to vibrate or meeting mode and avoid to maximum extent using them in the room, and if necessary to conduct any conversation here as quietly as possible in order to not disturbing the proceedings. Even when the phone is not in use but switched on, it can interface with electrical equipment. So please do not place it near to microphone or earphone. I think that is making trouble. Thank you for your cooperation with this. So, as I said, we shall now embark on the marathon of 50 agendas in the next 48 hours. We have done 2, so we have 48 to go. So I will remind you how it progressed so that we can always share the sense of how many items to be discussed. Now let's go to our next agenda. Agenda is a report of the Director General. I am seeing DG, and that is perhaps the most hard-working man in the world. So it's my pleasure to ask the Director General to take the floor to present his report of the Director General. Floor is yours, Dr. Tedros.
Thank you, Chair. Excellencies, distinguished members of the Executive Board, dear colleagues and friends. First of all, I would like to say good morning and welcome once again, and thank you for your moving tributes to our late friend and colleague, Dr. Pete Salama, and for all those we have lost in the past year. It's clear from what you have said that he enjoyed as much trust and respect from member states as he did from his colleagues in the Secretariat. I shared my reflections on Pete at the PBAC. Many of you were here, and I don't think it's necessary to repeat now. You have said it all, and I fully concur with all the things you said about Pete. The expressions of sorrow over the past week and of admiration for everything Pete did and everything he was say it all. We miss Pete now, and we will always miss him. And the other thing I'd like to share with you is the 4 deaths in Biakato, which I haven't said in my PBAC meeting. They were killed in cold blood while saving lives. You know, they were facing Ebola and they were facing bullets. So bullets killed them. Immediately after the attack, I went to visit the wounded ones. There were 7 seriously wounded colleagues too. And the stories the wounded colleagues told me was very, very horrifying. And I just wanted you to imagine in what condition our colleagues are working, our responders are working, not only from WHO, but all organizations, be it UN, the civil society, NGO, but more importantly, including the government, because it's the strong government's leadership which is helping us to get result. And many of the losses, by the way, are from government. And working in that condition, as you know, is how difficult it is. And the story is very terrifying. But despite that, they went back again, because they said the death of their colleagues strengthens their resolve, and that they will go back to finish the job. And that's why now Ebola is almost zero. The last 16 days was almost done, but we had 1 case again yesterday, but I hope we will finish it as soon as possible. But for the Ebola situation to be what it is now, we paid life. And we have to give them our due respect. And thank you so much, Chair, for doing that. Excellencies, dear colleagues and friends, 2019 was a year of unprecedented challenges, unprecedented achievements, and unprecedented transformation. It was a very rewarding year and a very tough year as we pushed hard to finalize the design phase of transformation which touches every corner of the organization, while fighting emergencies, launching new initiatives, and striving towards the 3 billion targets. Allow me to summarize some of last year's key achievements according to each of those targets. First, 2019 was the year our new division of healthy populations was born, reflecting the new emphasis we are putting on health promotion and disease prevention by addressing the root causes of ill health. We reached a historic agreement with the International Food and Beverage Association, which has committed to eliminate industrially produced trans fat from the global food supply by 2023. Together with the Food and Agriculture Organization of the United Nations, we launched a new tool which allows countries to analyze the strengths and weaknesses of national food systems and prioritize interventions. We published new guidelines to help frontline health workers to recognize children who have suffered sexual abuse and to provide evidence-based first-line support. We worked with civil society and other partners to improve road safety in Chile, Kazakhstan, Malaysia, Slovenia, Trinidad and Tobago, and more. We established a new department on social determinants of health and convened a meeting of international experts to identify ways to strengthen and deepen WHO's work in this area over the next 4 years. More than 80 cities in more than 50 countries have committed to WHO's air quality guidelines, and we began implementing the initiative on climate change and health in small island developing states following its approval at the World Health Assembly. Our vision is that by 2030, every island in the Pacific will have a health system that's resilient to climate change. The urgency of this challenge was brought home to me during my trip to Tahiti, Tonga, Tuvalu, and Fiji last year. In Tonga, I planted a mangrove in an area which used to be a rugby field, where Tonga and Fiji played each other in 1924. But it's now fully consumed by salt water. And you can see the gravity of the problem. And Minister was with me, and great hospitality when I visited Tonga and the other islands, Tuvalu, Tahiti, and Fiji. Now let me turn to progress on universal health coverage. We saw many countries making progress. South Africa and the Philippines both passed new laws on UHC, while Greece, India, and Kenya rolled out ambitious programs to expand coverage. Our global monitoring report on UHC showed that while access to health services has expanded in all regions and across all income groups, we're going backwards on financial protection. In 2015, 930 million people spent 10% or more of their household consumption on health, and we know that number is growing every year. This trend can be turned around. The world spends 10% of global GDP on health, but we could and should be getting much better value for money. Too many countries spend too much of their health budgets on managing disease, instead promoting health and preventing disease, which is far more cost-effective. That's why WHO is calling for all countries to increase public spending on primary health care by at least 1% of GDP, either through new investments, reallocation, or both. As you have heard me say many times, health is a political choice, but it's a choice we see more and more countries making. At the United Nations General Assembly last year, all 193 UN member states approved the political declaration on universal health coverage, the most comprehensive international health agreement in history. And thank you to you all for fighting to have that historic resolution. Then at the Interparliamentary Union Congress in Belgrade, Serbia, legislators adopted a resolution on universal health coverage, committing to leverage the power of parliaments to translate political commitment into policies. And the commitment of the MPs I met there was very, very strong. And we hope we will get all the support we need from the MPs. They are very crucial and central in pushing the UHC agenda forward, as you know, and also my experience as former member of parliament. And just as countries are coming together, so the international health community is also coming together to support them. Together with 11 other global health agencies, WHO launched the Global Action Plan for Healthy Lives and Well-being for All. The 12 signatory agencies are now moving from commitment to action, laying the foundation for the UN Decade of Action for the SDGs and beginning to demonstrate the path to results in countries in 4 ways. We're engaging countries to identify priorities. We're working with Mali, for example, as it strives to provide free access to 100% of its population through a package of essential services. We're establishing joint working groups to accelerate our support for countries, for example, to mobilize more resources for health in Ghana and to spend them better. We are aligning our ways of working by institutionalizing the plan within the agencies and becoming a pathfinder for UN reform. And we're developing a joint monitoring framework to keep account of progress, with the first joint progress report to be presented around the World Health Assembly in May 2020. But I would like to use this opportunity to thank Germany, Norway, and Ghana for being the pathfinders for this and for bringing the idea of the global action plan, and that culminates in the signing of the 12 agencies to work jointly. In addition to these significant milestones, WHO also signed a memorandum of understanding with the African Union to develop the African Medicines Agency, and an agreement with France to establish the WHO Academy. One of the most important issues for the realization of universal health coverage is improving the accessibility and affordability of medicines. For the first time last year, WHO pre-qualified a biosimilar medicine, a cheaper version of the breast cancer drug trastuzumab, making this life-saving therapy more affordable for countries and more accessible for women who need it most. We expect to pre-qualify more and more of these very effective but very expensive medicines in the coming years. So we have started the first step. We will continue to invest on pre-qualifying biosimilar medicines that will increase accessibility and affordability. We also launched a pilot procedure for the pre-qualification of biosimilar human insulin, published a cancer medicines pricing report, and held our second fair pricing forum. And you can imagine when we do the human insulin, how it will benefit many of those who are using it regularly in terms of affordability. As you know, health workers are also vital to achieving universal health coverage, and especially nurses and midwives. The Year of the Nurse and the Midwife gives us a wonderful opportunity to highlight the incredible role nurses and midwives play, and to draw attention to the shortfall of 9 million nurses and midwives the world is facing between now and 2030. We're calling on all countries to invest in nurses and midwives as part of their commitment to universal health coverage. This year, WHO will also publish its first report on the state of the world's nursing to provide a snapshot of the global nursing workforce. We hope that countries will use the data from this report to make evidence-based decisions on how and where to invest in the nursing and midwifery workforce. But I assure you, many countries have serious challenges in this area, and I hope the report will benefit them. On non-communicable diseases, there is plenty of good news. Globally, the number of men using tobacco has finally started to decline. At the same time, we have seen growing evidence about the threat posed by e-cigarettes. This is an increasing area of focus for WHO. 12 countries scaled up hypertension management using the WHO Heart's technical package, and more than 700,000 people globally are now on protocol-based treatment. As a result, hypertension control has improved in all countries. And this is our priority because globally we have more than 1.2 billion people with hypertension, and only 200 million of them managing it, 1 billion, as Tom Frieden calls them, walking bombs. This is serious, and that's why we have started to invest on this, and it's not too late Please give it attention. With the International Telecommunications Union, we launched standards for safe listening to reduce the risk of hearing loss among users of personal audio devices. These standards have already been integrated in the health application on iPhones. We launched the Global Initiative for Childhood Cancer in 6 countries, and we have developed a draft strategy on eliminating cervical cancer, which you will consider at this Executive Board. We also launched the WHO Special Initiative for Mental Health, with the aim of increasing access to quality and affordable care for mental health conditions to 100 million more people. We have held a consultation with the first 6 countries, Bangladesh, Jordan, Paraguay, the Philippines, Ukraine, and Zimbabwe. Thank you to Switzerland and the United States for their generous support for this program. We trained 6,000 health workers in Ghana on mental health through the Quality Rights e-training platform. And we issued new guidelines on reducing the risk of dementia. The High-Level Commission on Non-Communicable Diseases has also been working on the second phase of its work, and I look forward to receiving its final report and recommendations. On infectious diseases, there is more good news. By the end of 2019, 77 countries had national policies that support HIV self-testing, helping to reach people at higher risk from HIV, including those who are most marginalized and not accessing health services. Egypt, which has one of the world's highest burden of hepatitis C, is now on track to be one of the first countries to eliminate it. Beginning with strong political commitment, Egypt has provided screening for 60 million people and treatment for 3.7 million people, largely through primary health care, integrated with screening and care of non-communicable diseases such as hypertension and diabetes, along with a national initiative on cervical and breast cancer. This is a truly stunning achievement, and that could be a good lesson for other countries. Australia, France, Georgia, and Mongolia are also moving towards hepatitis C elimination, enabled by dramatic reductions in the price of direct-acting antivirals. On malaria, the WHO Strategic Advisory Group on Malaria Eradication and the Lancet Commission on Malaria Eradication both published their reports on what we need to do to realize our shared vision of a malaria-free world. Argentina and Algeria were certified as malaria-free. And we launched a pilot program for the world's first malaria vaccine in 3 countries, Ghana, Malawi, and Kenya. Despite these gains, we continue to see more than 200 million cases of malaria annually. More than 400,000 people die each year from this preventable and treatable disease. In recent years, progress in reducing new malaria infections has leveled off. Most worrying of all, malaria is one on the rise across many high-burden countries in Africa. In response, WHO and the RBM Partnership to End Malaria have launched high-burden, high-impact. This is a targeted new approach to accelerate progress in the countries hit hardest by the disease. 11 countries that carry 70% of the malaria burden globally. So we will have a focused, serious measures. With WHO support, these countries are pioneering smarter use of their data, which when coupled with top quality guidance from WHO will lead to a more targeted malaria response. On tuberculosis, 7 million people were diagnosed and treated for TB in 2018, up from 6.4 million in 2017. Our aim for this year is 8 million. The WHO multi-sectoral accountability framework for TB was launched and is already being adopted and implemented in countries. WHO has also developed new policies and guidelines to ensure better outcomes for those affected, including strong recommendations for the first time for fully oral regimes for the treatment of multi-drug resistant TB. On neglected tropical diseases, Yemen and Kiribati eliminated lymphatic filariasis, and Mexico eliminated rabies. And for the first time, the number of human African sleeping sickness cases reported globally fell below 1,000. On antimicrobial resistance, 135 countries have now developed multi-sectoral AMR national action plans. 90 countries have enrolled in GLASS, the global surveillance platform that will provide the data for newly approved SDG indicator on AMR. 159 countries have provided data to track progress in the implementation of their AMR national action plans. We have established a standing tripartite joint secretariat to consolidate cooperation between WHO, FAO, and OIE. The Secretariat will facilitate the implementation of the recommendations of the UN Interagency Coordination Group, whose report was submitted to the Secretary General last April. Thanks to the support from the governments of Netherlands and Sweden, we have also launched the Multi-Partner Trust Fund on AMR to catalyze action in countries. One of the crucial barriers we're facing is the lack of new treatment options in the pipeline. Just last month, WHO published a new report which shows that the 60 antimicrobials currently in development bring little benefit over existing treatments, and few target the most critical resistant bacteria. To stimulate research and development into new and much-needed medicines, we're working with the European Investment Bank on a new investment fund, and we will have more news about that in the coming months. At the same time, we're striving to protect the antibiotics we have by working with countries to strengthen infection prevention, stewardship, hygiene, water, and sanitation. WHO continues to prioritize the health of those who are most disadvantaged, including women, children, and adolescents. Last year, we revised our recommendations for contraceptive use by women at high risk of HIV and published new global estimates of maternal mortality. We have launched Survive and Thrive, a new report drawing attention to the plight of vulnerable newborns and identifying key interventions for transforming care for small and sick babies. Let me now turn to emergencies. As you know, it was an extremely busy year for WHO's emergencies programs. During 2019, WHO responded to 58 emergencies in 50 countries. You only hear about the few of them. 58 emergencies. We must be honest, it was a difficult year in our fight to eradicate polio. There were 173 cases of wild polio virus last year, the most since 2014, and many outbreaks of vaccine-derived polio virus, mostly in Africa. But there were also several reasons for cheer. We certified the global eradication of wild polio virus type 3, and no wild polio virus has been detected in the African region for over 3 years. We also launched the new strategy for the Global Polio Eradication Initiative with $2.6 billion pledged by donors at the Reaching the Last Mile Forum in the UAE. Despite last year's setback, I'm confident that with a strong new strategy backed by strong financial support and strong political commitment in Pakistan and Afghanistan, We're on the right track for realizing our vision of a polio-free world. Last July, I declared the Ebola outbreak in the Democratic Republic of Congo a public health emergency of international concern. Since the outbreak began in August 2018, there have been 3,421 cases and 2,242 deaths. But thanks to the incredible efforts of thousands of frontline responders and the solidarity of the international community and the leadership of the government above all, the outbreak has been steadily declining. The rapid approval and pre-qualification of the Ebola vaccine after a trial involving 250,000 people and the advent of experimental therapeutics have also helped us to save lives. This is an incredible public health triumph. 5 years ago, we had no vaccine and no therapeutics for Ebola. Now we can say Ebola is preventable and treatable. Last week, there were just 5 new cases, the smallest number since the beginning of the response. This is a very encouraging trend, but until we get to zero, there is always the risk that the outbreak could flare up again. The insecurity of the region continues to pose a threat to our ability to extinguish the outbreak. That's exactly what happened in November, when several security incidents undermined the progress we had made and the horror story I told you. And just in the last few days, more civilians were killed by armed rebels in the Beni region. That was on Thursday. WHO currently has about 630 staff in DRC to support the Ebola response. And we will continue to work with full determination until we can celebrate the end of this outbreak. But even as we focus on ending this outbreak, we must also think beyond Ebola to strengthening DRC's weak health system. We have already prepared a roadmap with the government and are planning a meeting later this month with the President and senior ministers to identify how WHO and others can support the DRC in this process. This is beyond Ebola. Strengthening health systems in fragile and conflict-afflicted states is something we must prioritize if we are to achieve our 2030 goals. As you know, last week I declared another public health emergency of international concern, this time over the outbreak of novel coronavirus. As of this morning, there are 17,238 confirmed cases in China and 361 deaths. Outside China, there are 151 confirmed cases in 23 countries and 1 death, which was reported from Philippines yesterday. During my visit to Beijing last week, I was so impressed in my meeting with President Xi at his detailed knowledge of the outbreak and for his personal leadership, but also at his commitment from the words he told me I will share with you. We will take serious measures at the epicenter, at the source, in order to protect our people and also to prevent the spread of the virus to other countries. We have the obligation to do that, and that's what we will do. And that's exactly the strategy we discussed with him. If we invest in fighting at the epicenter, at the source, then the spread to other countries is minimal and also slow. If it's minimal and slow, what is going outside can also be controlled easily. So the number of cases, for instance, we have now, as we speak, 151, it's actually small, and it's coming only slow. So it can be managed. But when I say this, don't make a mistake, it can get even worse. But if we give it our best, the outcome could be better. And because of this strategy, and if it weren't for China's efforts, the number of cases outside China would have been very much higher. And it could still be, but we have the opportunity now to work aggressively to prevent that from happening. The decision to declare a FIC was taken primarily because of the signs of human-to-human transmission outside China and our concern of what might happen if the virus were to spread in a country with a weaker health system. WHO has made several recommendations for all countries to prevent and limit the further spread of the virus. First, there is no reason for measures I will repeat this. These are the recommendations. First, there is no reason for measures that unnecessarily interfere with international travel and trade. We call on all countries to implement decisions that are evidence-based and consistent. WHO stands ready to provide advice to any country that is considering which measures to take. Second, we must support countries with weaker health systems. Third, accelerate the development of vaccines, therapeutics, and diagnostics. Our global connectedness is a weakness in this outbreak, but it's also our greatest strength. We need strong public-private partnership to find solutions. Fourth, combat the spread of rumors and misinformation. To that end, we have worked with Google to make sure people searching for information about coronavirus see WHO information at the top of their search results. Don't worry, it's not corona. Social media platforms, including Twitter, Facebook, Tencent and TikTok, have also taken steps to limit the spread of misinformation. Fifth, review preparedness plans, identify gaps and evaluate the resources needed to identify, isolate and care for cases and prevent transmission. Sixth, we call on all countries to share data, sequences, knowledge and experience with WHO and the world. And seventh, the only way we will defeat this outbreak is for all countries to work together in a spirit of solidarity and cooperation. We're all in this together, and we can only stop it together. So the rule of the game is solidarity, solidarity, solidarity. But we see this missing in many corners, and that has to be addressed. I'm taking advice from a wide range of experts in this field as a complement to the emergency committee to ensure we understand the evolution of the outbreak and respond accordingly. Both the coronavirus and Ebola outbreaks underscore once again the vital importance of for all countries to invest in preparedness, not panic. So far, more than $1 billion has been spent trying to stop Ebola outbreak in DRC. By comparison, just $18 million was spent on preparedness in Uganda. But when Ebola did cross the border to Uganda, they were ready and stopped it. This must be a lesson for the rest of the world. Last year, the Global Preparedness Monitoring Board published its first report, which concluded the world remains dangerously unprepared for a global pandemic. For too long, the world has operated on a cycle of panic and neglect. We throw money at an outbreak, and when it's over, we forget about it and do nothing to prevent the next one. Even in the context of the current Ebola outbreak, although we now have sufficient funding for the response, funding for preparedness in surrounding countries has remained grossly inadequate through outbreak. This is dangerously short-sighted and frankly difficult to understand. If we fail to prepare, we're preparing to fail. That's exactly why WHO has established the new division of emergency preparedness. In March, we will bring together ministers of health, finance and foreign affairs at the Marrakesh meeting on health diplomacy to discuss what can be done to improve preparedness globally. With Ebola and coronavirus also illustrate that the current binary FIC or no-FIC system is too blunt an instrument for dealing with complex emergencies. We have a green light and a red light and nothing in between. So we need to have a yellow light, like the traffic light, maybe other mechanisms, but the yes-no binary is not really suitable for emergencies. It's too restrictive, too simplistic, and not fit for purpose. So we need to change, improve it. We're therefore exploring options for tools that would allow us to signal an intermediate level of alert without reopening negotiations on the text of the international health regulations. And we will seek your support. As you can see, 2019 was an extremely challenging yet productive year. 2020 promises to be no different. To maximize the opportunities and rise to the challenges before us, the world needs a WHO that's agile, responsive, and fit for purpose. And in our era of fake news and misinformation, more than ever, the world needs a WHO that brings reliable science and evidence to bear on the decisions we make about health. For each of the triple billion targets, we need to invest in WHO's core business norms and standards. Our new science division at headquarters reflects our commitment to being at the forefront of science and producing the world-class and evidence-based norms and standards the world expects of us. In the past year, this new division has convened expert advisory committees on human genome editing and digital health. As part of our new process for assuring the quality, timeliness, and impact of norms and standards, we have created a new quality assurance department to standardize and optimize the planning methods, design, and dissemination of 100 normative products. To keep us accountable for delivering the GPW, we're also creating a new delivery unit which will track progress, triple billion targets. That will help us to be accountable to you. As I said at the member state briefing last week, transformation is a journey. We have come to the end of one part of the journey, the design period, but we have not come to the end of the road. The road ahead is now to focus on the implementation and on delivering results in countries. As you know, transformation involves 5 major areas of work: a new strategy, new processes, a new operating model, a new approach to partnerships, a new culture. In addition, there are 2 cross-cutting areas of work that enable the other 5: sustainable financing and a fit-for-purpose workforce capacity building. As member states, you have been closely involved in shaping the first major area of work, our new strategy, which is the foundation for everything else. You have also shaped the program budget and the results framework that are fundamental to its delivery. This is the first GPW, by the way, impact and outcome based, the first GPW in the history of WHO. The other areas of work flow from the strategy and reflect the internal work we need to do at the Secretariat to deliver your priorities. So the plan, just one phrase: result at country level. That's it. Our new planning process is a perfect example. The new process has resulted in the development of WHO's first set of country support plans and our first list of global public health goods. This is a set of more than 300 technical products distilled from more than 1,000 proposals that WHO will produce this year and next based on what countries told us they needed. We are already rolling out our new resource mobilization process, building on the launch of WHO's first investment case, our first partners forum in Sweden, and our new resource mobilization strategy. You have often called us to diversify our funding base, and we're working hard to do that. Many other processes are now being rolled out, including for performance, management, norm standards, communications, data, research, and more. Our new operating model took full effect as of the 1st of January this year. It brings new clarity to the roles of each level of the organization, new alignment in our structures, and new ways of working to help us operate as one WHO. We have also introduced cross-cutting teams to break down silos and foster integrated delivery of results in key areas like primary health care and antimicrobial resistance. We have strengthened in the areas you asked us to strengthen in data, emergency preparedness, norms and standards, and science. Our regions have also announced new structures that reflect the 4 pillars of the operating model. Deep functional reviews have been conducted in 81 countries across 4 regions. Last year, we made real progress on implementing our new approach to partnerships. First, we strengthened our relationship with traditional partners through the Global Action Plan for Healthy Lives and Well-being for All and our engagement with civil society. Second, we brought a new approach to building high-level political commitment at international and national levels, for example, through the UN General Assembly and the G20 and G7. And third, we embarked on innovative partnerships that can help us reach groups we haven't reached before, for example, with FIFA and Google Fit. We're also working with Facebook and Pinterest to ensure their billions of users get reliable information about vaccines and other health issues. And finally, we launched our new values charter, which defines 5 values that underpin and guide our day-to-day work: trust, professionalism, integrity, collaboration, and care. We're now working to embed these values into everything we do. As member states, you will continue to be involved intimately in transformation by keeping us accountable for the results we deliver. Thank you for your hard work on the results framework. The balanced scorecard is groundbreaking within the United Nations system. We have asked a lot of you, but that's because we are asking a lot of ourselves. We're holding ourselves to high standards, trying to do things that have never been done before at WHO. We're committed to continued transparency and continued accountability as regional directors and I work together to realize the bold ambition of the 3 billion targets. Excellencies, dear colleagues and friends, you have a full agenda this week, so it's time for me to stop and let you get on with your work. I look forward to answering your questions. All of the issues you're considering will contribute to our pursuit together of the 3 billion targets and the Sustainable Development Goals. I wish to thank all member states and all our other partners for your support for WHO as we work together to promote health, keep the world safe, and serve the vulnerable. The most important thing, especially at these difficult times, is I will repeat: solidarity, solidarity, solidarity. I thank you. Merci beaucoup. Shukran jazilan. Shishe. Muchas gracias. Spasiba. Arigato. Thank you.
Thank you very much, Director General, for your wonderful and a comprehensive report. My sense is that the report does contain many issues which will be dealt with in already existing agenda. So my humble suggestion, I have no intention to limit your scope of contribution, but perhaps you can focus on high-level issues or strategic issues in response to Dr. Tedros' report, which will be perhaps very beneficial. And then, I'm sorry to interrupt you for your enthusiasm to raise the flag, but it took almost more than 90 minutes. So why don't we give ourselves 1 minute to stretch, so that I think we can have refresh and come to the debate. So let's do not go out to the room and just stretch on your own way.
We don't have music.
No. It's
No
all right.
music?
Yeah.
Follow the
No.
Follow the chair.
So if we do the music, that takes 5 minutes. Okay.
Follow the chair.
No. Excellent speech.
Thank you.
Okay.
Yeah, you need music.
Okay. Yeah.
The Chinese just approached me, they would like to make an intervention on Corona.
Yeah, of course.
Ask him to do this first.
Okay. Yeah. All right. Good. China would like to. Yeah. Okay. Go first.
Okay.
So I will ask whether someone would like to make a regional statement and grouping up the regional countries.
It doesn't look healthy.
Yeah, normally they will indicate when they take the floor if they're taking on behalf of a region.
Yeah.
So, yeah.
But I think Avatar says that if Singapore says that I would like to do a regional statement, then after Singapore, UPLO countries just add on. That way, I think.
It's a bit different for the board members, I think, than the others outside the board. That's the only concern I have there. So, yeah.
Okay. Shall we start our business of discussion? Order, please. Silent and order, please. During this exercise, I had a serious challenge I faced. That is, music's needed, but I cannot sing. If I sing, that is problematic for you. So I think I see recognize placards, a lot of speakers, and those who wish to make a regional statement, please let me know by showing flags. Regional statement, Germany. Regional statement, Germany and Australia, Israel, and Tanzania. Thank you very much. But I received special request from EB member from China to speak first, so I'd like to give him the floor first. China, floor is yours.
主席先生，中国代表团感谢总干事的报告。我们也愿借此机会对 Peter Salama 博士的突然离世表示哀悼。主席先生，新型冠状病毒是全世界面临的共同挑战。中国政府本着对中国人民和全世界人民生命健康高度负责的态度，果断采取了最为全面严格的防控举措。中央政府统一领导、统一指挥疫情防控工作，已将新型冠状病毒感染的肺炎纳入乙类传染病，并按照甲类传染病管理。全国所有省份启动重大突发公共卫生事件一级响应。正因为这些及时的、强有力的、负责任的措施的实施，使得99%的病例围堵在中国国境之内。 疫情发生以来，中方及时、透明、公开、高效地通报了疫情信息。自1月3日起，定期与世界卫生组织、有关国家和地区组织以及港澳台地区及时主动地通报疫情信息。1月12日，确定病原体为新型冠状病毒后，第一时间向世卫组织和国际社会分享了基因序列。随后，港澳台专家组和世卫组织考察组赴武汉进行了实地考察，了解疫情发展和病例救治情况。1月28日，谭德赛总干事访华，习近平主席、王毅国务委员兼外长、马晓伟主任分别会见，就疫情防控进行了坦诚的交流。世卫组织对中方防控工作评价客观积极，表示中国实际上正在为疫情应对树立新的国际标杆。1月30日，世卫组织宣布疫情构成 fake， 并发布临时建议，并对中国的防控措施作出了公正客观的评价。临时建议指出，不建议采取任何旅行和贸易限制措施。这不仅仅与中国有关，这与每个国家、每一个人都有关。2014年西非Ebola 应对联合国高级评估小组曾经指出，采取额外的国际交通限制措施，可能会使一些疫情国因担心受到限制措施的影响，而不再主动向世卫组织报告信息，这反而会加重疫情的蔓延。这是每一个发生了疫情的国家和每一个可能发生疫情的国家都不希望看到的。然而，部分国家近来还是采取了一系列旅行和贸易限制措施，包括禁止过去14天内访问过中国的外国人入境，拒绝持有中国湖北发放护照的中国人入境，暂停发放签证、取消航班等。这些措施与世卫组织的建议严重不符。习近平主席在会见谭德赛总干事的时候指出，疫情是魔鬼，我们不能替魔鬼藏匿实情。与此同时，国际社会更需要公正、客观、冷静、理性地看待新疾病。不要过度的、负面的、消极的解读，或者人为制造恐慌，甚至进一步加剧恐慌情绪，这样会严重干扰疫情防控国际合作大局。正如谭德赛总干事讲到的，我们需要事实，而不是恐惧；我们需要科学，而不是 rumor；我们需要团结，而不是 stigma。中国政府将继续本着对中国人民健康和全球公共卫生安全负责任的态度，有力地实施国内各项防控措施和世卫组织临时建议，继续一如既往地与世卫组织、有关国家和港澳台地区分享信息。中国政府和人民有决心、有信心、有能力战胜疫情。我们也将继续秉持公开透明的原则，与包括世卫组织在内的各方积极开展疫情防控国际合作，团结一致迎接新病毒的挑战。 赢得抗击疫情的最后胜利。谢谢。
Thank you very much. Now we are going to have a debate on DG's report. May I recognize that Australia, Germany would like to make a regional statement. Other board members would like to make regional statements? Tanzania as well. All right. And also Israel as well. So do you think it's agreeable that regional statement, but Germany and Israel come from? Okay. Oh, okay. So I was advised that regional statements and group statements, group statement can be. Is it agreeable to listen to regional statements and then open the floor to the country where that regional statement was delivered, so that I think following regional members can add on the element which was not included in the regional statements. Shall we do the exercise? And the first experiment animal, it will be Australia. Is it all right? I'll start from Western Pacific region. So what I on my list is regional countries who would like to speak is Singapore and Japan. It's all right? All right? So I think Australia, as a regional statement, you have 5 minutes. And the two following EB members, starting with Singapore, followed by Japan, will be given 2 minutes, but focus on the element which was not covered by regional statements. Let's try whether that works. Okay. Australia, are you going to make a regional statement or group statements? Group statement. Yes, Germany would like to make a regional statement. Am I right? Okay, Germany goes first and followed by our member states of that region. But Israel would like to have group statement. Okay, good. Okay, good. So Germany, go first, please.
Thank you, Chair. Director General, members of the Executive Board, colleagues, I have the honor to speak on behalf of the European Union and its member states. The candidate country, Montenegro, and the countries of the Stabilization and Association process and potential candidate, Bosnia and Herzegovina, as well as Ukraine, align themselves with this statement. The EU and its member states thank the Director General for his report. We offer our condolences to the family, friends and colleagues of Dr. Peter Salama upon his untimely passing. His personal commitment to global health and to leaving no one behind shines as guiding light for the rest of us. We would like to thank the DG for his report from his visit to China last week. We highly appreciate the commitment of the Chinese authorities to transparency and swift measures in the response to the ongoing outbreak of the novel coronavirus. This situation has yet again demonstrated the importance of international collaboration and open and rapid sharing of information. We encourage WHO to ensure that information from all affected countries is shared without delay with WHO member states and with partners. Such real-time knowledge and involvement is essential to planning and implementing a response and countermeasures and to containing outbreaks. We appreciate the efforts taken to improve WHO's efficiency in responding to public health emergencies and capacities of countries. However, on a more general level, we would like to call attention to the need for urgent action to improve preparedness, essential public health functions and health systems in countries. DG, When it comes to transformation, we would like to stress the centrality of making WHO more efficient and responsive to needs of all member states and strengthening its role within the wider UN system. The GPW 13 has set ambitious goals and increased the level of the 2020-21 budget. We would therefore like to underline the role and responsibility of the governing bodies in defining major changes for the organization. We repeat our concern about the lack of transparency regarding the Accountability Compact. We would like to thank the Secretariat for the organigram and hope to soon receive one completed with names to help us in our daily contacts with the Secretariat. Furthermore, it is critical to demonstrate reliable methods for accountability through the results framework, and we call for collaboration with Member States in developing a stepwise approach for its impact component. The EU acknowledges WHO's strategic leadership role in the evolving global health architecture, as demonstrated by its coordinating role in the implementation of the SDG 3 Action Plan. Any challenges linked to this strategic role, including the allocation of adequate resources to critically important programs, should be brought to the governing bodies. WHO needs to remain relevant and continue developing new approaches. For us, the normative work and the common goods for health are of high importance. We expect WHO to generate policies on topical issues such as the health impacts of climate change, digitalization and the challenge of antimicrobial resistance. Health should not only be seen as a cost. We stress the importance of health in sustainable societal and economic development. Health is a human right and an important societal value. The health sector is acting as a large service provider, industry and employer, generating a significant proportion of GDP. A healthy workforce has a positive impact on productivity, including in the context of aging societies in many countries. Addressing health challenges requires interaction and collaboration between different policy areas. We would request DGs to start a dialogue on the role of health in the economy and society while taking into account ethics, solidarity and human rights. Lastly, we support the UN development system reform and a more efficient, transparent and accountable UN. We encourage WHO to further build partnerships, to foster collaboration and synergy among UN agencies, and to continue working on cost savings and efficiency gains. We look forward to receiving WHO's report in May on the requirements of the UN funding compact. We also encourage WHO to reinforce its cooperation with vertical funds, especially in the run for the next global fund allocation process, which could, with the right input of the WHO expertise at country level in the coming weeks, open funding for health system strengthening. Chair, the EU and its member states remain committed to contributing to the work of the World Health Organization. I thank you.
Thank you very much. I do not recognize any placard from EU board member. So may I, Tanzania, you would like to make regional statements? So floor is yours, Tanzania.
Chairperson, Tanzania is honored to take the floor on behalf of the 47 member states of the Africa region on this agenda item. We express our sympathy to the government and peoples of the Republic of China for the lives lost because of the current outbreak of novel coronavirus. The Africa region appreciates the prompt and adequate response demonstrated by the government of China in an effort to contain the outbreak. As the Director General repeatedly said, the crisis could have been worse had it not been for the strict and timely measures taken by China. The Africa region would like to assure the Chinese government that we will continue to cooperate in the spirit of solidarity. We would also like to appreciate WHO's swift response to the situation. WHO managed to quickly develop an interim guidance for the lab diagnosis, clinical management, and risk communication. WHO has also been in regular and direct contact with member states, both affected and those at risk, providing support as required. We commend the Director General for his leadership over the past month in engaging with high-level government authorities and for continuously updating the situation for member states. We also appreciate the Director General for convening the emergency committee, and we welcome his declaration of the outbreak as a public health emergency of international concern. We also share the Director General's call for a special focus on countries that have weak health systems, most of which are in our region. Although currently there are no confirmed cases in the Africa region, we take note that member states are vigilantly strengthening their preparedness measures. Further, the Africa region would also like to express its appreciation for WHO staff and the Director General for the support provided to Democratic Republic of Congo and neighboring countries in the effort to contain the second largest Ebola epidemic on record. Even though the number of new cases of Ebola is decreasing, the death toll due to measles in DRC has peaked, with 5,000 deaths since January 2019, mostly among children below the age of 5. This needs urgent attention. The Africa region also condemns any kind of attack on health workers who are the first responders who are putting their lives on the line daily for the well-being of others. Chairperson, on transformation agenda, the Africa region would like to commend the Director General for leading the process. We are proud that the Regional Office for Africa has progressed ahead in terms of implementing WHO transformation agenda and carried out functional reviews in all 47 countries in the region. We wish to see the transformation agenda to further improve the way how WHO operates, enabling the organization to be more responsive to the prevailing urgent health challenges for the decade of action, particularly at the country office level. As a region, we understand very well that transformation cannot be achieved overnight. For that reason, the Africa region would like to assure the Director General and his team of our support as we journey together. When WHO wins, we all win. Our people win. I thank you, Chair.
Thank you very much. From the region where a regional statement is given, that is a placard, I recognize Kenya. Is there anyone from African regions? Otherwise, I give floor to Kenya. Floor is yours, sir.
Thank you, Chairperson. Kenya aligns her statement to that delivered by the United Republic of Tanzania on the report of the Director General. Chairperson, like other speakers, I wish to convey Kenya's heartfelt condolences to WHO and the family of Dr. Peter Salama following his untimely demise on 23rd January 2020. Tribute after tribute has revealed that Dr. Salama was loved by everyone who had the good fortune of knowing him. His last official mission to neighboring Somalia truly revealed his heart and passion to ensure that we leave no one behind. Let us honor his legacy by recommitting to these same values and ideals. Chairperson, Kenya would like to thank the Director General for his very informative and succinct report. We take note of the updates on the 2019 novel coronavirus outbreak in China, as well as the Ebola outbreak in DRC. Kenya is closely monitoring the global and domestic situation and has strengthened preparedness in this regard. We also take this opportunity to convey our deep sympathy to China and urge WHO and member states to focus investments in health system strengthening if we are to deal with the emerging health challenge of this decade. In conclusion, we wish to appreciate the Director General for the continued technical support provided the Ministry of Health as we implement our UHC Roadmap 2019-2022. We call on WHO to demonstrate the concept of countries being at the center of the transformation agenda by ensuring increased financial allocations to WHO regional and country offices. Further, we request the donor community to consider increasing flexibility in their funding for greater impact at country level. Thank you, Chairperson.
Thank you very much. I still recognize two group contributions, one from Australia and other from Israel. So first I give floor to Australia, followed by Israel.
Thank you, Chair, and thank you, Director General, for your report. Before I deliver a cross-regional group statement on the topic of the WHO transformation, I want to commend you and also particularly recognise our Chinese colleagues on the enormous effort to respond to the coronavirus outbreak. We look forward to further discussions on this and on the critical topic of health emergency preparedness. Can I also acknowledge your words on the challenges facing our Pacific neighbours and assure you of the Australian Government's support for WHO's efforts in relation to the International Year of the Nurse and Midwife and in relation to the challenge of e-cigarettes, something our Government has taken a very strong stand on. I will now make a statement on behalf of Australia, Argentina, Canada, the Czech Republic, Denmark, Finland, France, Germany, Indonesia, Ireland, Japan, Luxembourg, Monaco, Montenegro, the Netherlands, New Zealand, Norway, Sweden, Switzerland, Turkey, the UK and the US. I think I should get an extra minute just for that. Colleagues who were at the PBAC meeting last week will recall that we intervened to thank the Director General for the information provided about the transformation WHO is undergoing under his leadership and to reaffirm our support for his efforts as set out in paper A72/48 at the last World Health Assembly. I quote, to reposition, reconfigure and capacitate the organisation within the broader purview of the UN reform so that its normative and technical work is of even higher quality, more sharply focused on the needs, demands and expected actions of Member States and translates into results at country level. Last week we discussed aspects of the transformation under a number of different agenda items, and many of us will have more questions and comments as we work through this week's agenda. At this point, we intervene to reiterate the need to keep engaging Member States on the big picture. Given the ambition of transformation and its centrality to everything WHO does, strategic visibility of this process is essential for Member States' confidence in WHO's ability to deliver on the strategy we agreed for the organisation in the 13th General Programme of Work. We thank you, Dr. Tedros, and the WHO staff for the transformation work underway described in paper A72/48 to redesign and begin harmonising across major offices the processes that underpin WHO's core technical, business and external relations functions, align WHO's operating model across all three levels of the organisation for impact and initiate steps to ensure a culture and environment that enable effective internal and external collaboration, ensure that work is aligned with strategic priorities, bring out the best in staff members and continue to attract and retain top talent, and take a new approach to communications and resource mobilisation and to bolstering partnerships so that WHO is better positioned to shape global health decisions and generate appropriate and sustainable financing. This is a major change process and we appreciate that change does take time. While significant progress has been made and the building blocks are largely in place, particularly at headquarters level, there are areas of the transformation where activity and progress is less clear. Now is the time, as indicated in the next steps section of paper A72/48, that we expect a longer-term view of the capacities needed at each level of the WHO in the context of GPW 13, the health-related SDGs and UN reform. Member States need a concrete picture of the reforms at the different levels of the organisation to improve health outcomes for countries, including those related to WHO's full alignment with and engagement in UN reform. The end state, what will practically change and by when, needs to be crystal clear to ensure coherence and unity of action and to know when we have been successful. As such, we fully support the recommendation of the PBAC that the Board request a full update on the matters addressed in papers A72/48 and A72/49, with reforms mapped to timelines to be provided to WAR 74 through EB 148 next year, preceded by an interim report to the regional committee meetings later this year. Thank you.
Thank you very much. I think last component of proposals is, I think, it is included in PBAC report. So when we discuss PBAC report, the board will examine whether the board will agreeable that your last proposal part. So PBAC chair, is it all right with you? All right, good. So I think a group statement from Israel. Floor is yours.
Chairperson, Director General, distinguished delegates and colleagues. First, Israel would like to support the efforts led by the WHO and the Chinese government to contain the new coronavirus outbreak. As for the group statement, I am speaking on behalf of Albania, Australia, Austria, Barbados, Brazil, Bulgaria, Canada, Colombia, Cyprus, Czech Republic, Ecuador, Estonia, Eswatini, Ethiopia, Finland, France, Georgia, Germany, Guatemala, Guyana, Haiti, Hungary, Ireland, Israel, Italy, Latvia, Mexico, Monaco, Netherlands, New Zealand, Norway, Peru, Poland, Romania, Sierra Leone, Slovakia, Slovenia, Thailand, Uganda, United Kingdom, and United States and Uruguay. We would like to begin by thanking the Director General for a very comprehensive statement. Chairperson, the United Nations Disability Inclusion Strategy was launched in June 2019 by the United Nations Secretary General. This strategy enables the UN system to mainstream disability inclusion through all pillars of the UN's work. By ensuring the UN leaves no one behind, the strategy is core to the 2030 Agenda for Sustainable Development. The strategy sets the bar high, calling all UN entities to raise their standards and performance on disability inclusion by assuring the rights of persons with disability in all aspects of the organization's work. We welcome and fully support the new strategy and see it as directly linked to the WHO transformation process. Chairperson, we commend the efforts made thus far to promote accessibility and inclusion for persons with disabilities in the WHO. We see the full implementation of the UN Disability Inclusion Strategy as a necessary step to enhance these efforts even further in all levels of the organizations. WHO has a unique opportunity to set an example and lead on disability inclusion in the UN system in line with the strategy as the UN specialized agency responsible for public health. The successful implementation of the strategy will only be possible if actions are taken with the full support and commitment of the organization as a whole across all levels. We would like to assure you, Director General, that you may count on our support to achieve the goals of the UN Disability Inclusion Strategy. At the same time, we would like to express the importance of keeping Member States informed on the progress made in its implementation. I thank you for your attention.
Thank you very much. So we have completed regional and group statements, but that is a little bit difficult to my head to think about. So let's review whether this method works or not. And then following invitation is according to when we recognize a placard. So I would like the list is something like this. First goes to US, followed by Brazil, followed by Japan and Sudan. So let's start such 2 minutes contribution from EB members. First, may I give floor to the United States of America.
Thank you, Chair. Thank you, Director General, for your report. To begin, we express our deepest condolences to Dr. Peter Salama's family, friends, colleagues, and to the WHO. Dr. Salama devoted his professional life to improving health for the most vulnerable people. We will forever remember his lifetime of public service. Update on 2 critical outbreaks of international concern are extremely important. The novel coronavirus, now detected in over 24 countries and affecting the global community, requires focused attention. We express our support, prayers, sympathy, and appreciation to the people of China, and especially the health responders on the front lines who are protecting not only their communities, but the world. We are learning more about the virus every day and implementing appropriate public health measures in keeping with WHO's recommendations to minimize the spread, based on the best evidence available. The United States is committed with all partners to address this outbreak. At the same time, we must remain focused on the second largest Ebola virus outbreak in the Democratic Republic of Congo, and we will continue to support their efforts to respond. As the last several weeks demonstrate, WHO's work in partnership with member states and the global health community is essential to prevent, detect, and respond to public health emergencies. Our collective ability to address public health threats wherever they emerge depends on timely and accurate information, allowing a coordinated and inclusive response across all affected areas and public health authorities. Acknowledging the Chair's desire for a short statement, I will end mine there, and we look forward to the week ahead and a successful Executive Board. Thank you, Chair.
Thank you very much. Thank you. So our next speaker is Brazil, followed by Japan. Brazil, floor is yours.
Thank you, Mr. Chairman. On behalf of Brazil, I convey our deepest condolences to Dr. Peter Salama's family and friends. I also thank the DG for his report. Brazil commends the DG's leadership together with the WHO's emergency team for a timely and strong response for the coronavirus outbreak. China's relentless efforts, transparency, and cooperation are also to be commended. As far as Brazil is concerned, we are taking the necessary measures to prevent the spread of the virus within our borders, and suspected cases are being closely monitored. Mr. Chairman, the response to the present outbreak shows that the strengthening of WHO's emergency program has come a long way. But we can and must do more in preparedness, and in particular in building strong and accessible health systems. To do that, WHO needs to be more inclusive and responsive to the needs of the whole of the membership. This is what we expect from the transformation agenda. We need more action on cross-cutting areas. AMR, for example, is obviously of important concern, but it's only a partial response. Access to medicine and social determinants of health need to receive the same level of attention, including budgetary. They are central to build strong health systems. Without them, we cannot prevent, prepare, neither respond to health emergencies. Here, WHO can do better, definitely. The DG mentioned pre-qualification of biosimilar, and we commend that. It's a good step forward. He also mentioned Ebola vaccine. It's also good news. But we cannot forget the number of lives we lost before we had the vaccine. With strong health systems, maybe the Ebola story would be another one. So to end, Mr. Chairman, let me just say that safeguarding the status quo will only take us farther apart from the protection and promotion of health for all. And very important, it will not prepare us for the next emergency. As the DG said, if we fail to prepare, we prepare for fail. Thank you.
Thank you very much. Next speaker is Japan, followed by Sudan and Singapore. So, Japan, floor is yours.
Thank you, Chair. First of all, Japan would also like to express our sincere condolence to Dr. Peter Salama and his family. We also thank the Director General for his report. I have 3 points regarding the emergencies and the WHO transformation. First, regarding the new coronavirus, currently Japan has 20 confirmed cases, and some of them indicate human-to-human transmission within Japan. The Japanese government is committed at the highest level to take any measures in close collaboration with China, other member states, and the WHO to conquer this outbreak in the spirit of solidarity and cooperation. We expect strong leadership from WHO. We recently experienced turbulence of incoming communication from WHO. We are also aware that countries have already taken various measures based on their own risk assessments, even before the announcement of fake. Therefore, I wish to point out that it is critical for WHO to disseminate quick and accurate information to member states and to take timely action. In this context, we welcome briefing to member states mentioned by the chair. Second, regarding the biological material, on January 30th, the Japanese Institute of Infectious Disease has successfully isolated the novel coronavirus. Japan is ready to cooperate with others on research and development using this isolated virus. Third, regarding the transformation, Japan welcomes the development of GBW13 and some of the new ideas proposed so far, such as the integration of digital health in WHO. On the other hand, the transformation is not completed after 2 years. We request WHO to finalize the transformation process as soon as possible to demonstrate its 100% performance. Thank you, Chair.
Thank you very much. Next speaker is Sudan, followed by Singapore, and then Argentina. Sudan, floor is yours.
Thank you. Thank you very much, Mr. Chairperson. I will speak in Arabic. معالي الدكتور هيروشي ناكاتاني رئيس المجلس التنفيذي لمنظمة الصحة العالمية، معالي الدكتور تيدروس أدهانوم غبريسوس مدير عام منظمة الصحة العالمية، معالي السيدات والسادة الوزراء وممثلي الدول الأعضاء والمراقبين والمنظمات الإقليمية، السيدات السادة والحضور، السلام عليكم ورحمة الله. باسم شعب وحكومة جمهورية السودان نتقدم بتعازينا الحارة لشعب وحكومة الصين ولشعب وحكومة جمهورية الكونغو الديمقراطية وإلى كل الدول والشعوب التي حصدت الأوبئة والأمراض مواطنيها. إننا نعلن في حكومة السودان الجديدة تضامننا مع مجهوداتهم ومجهودات منظمة الصحة العالمية لحماية المواطنين ولحماية النظم الصحية من آثار الأمراض ومن آثار البطش والحروب ومن آثار الأنظمة القمعية والاحتلال والفقر والجهل والتهميش. نتقدم بتعازينا أيضا إلى منظمة الصحة العالمية وإلى أسرتي وزملاء وأصدقاء صديقنا الدكتور بيتر سلامة بعد وفاته المفاجئة، ونسأل الله أن يرحمه وأن يحسن إليه وأن يقدرنا على الانتصار لمبادئه وعمله إن شاء الله. سيد الرئيس، نشكر منظمة الصحة العالمية عبر مديرها العام ومديرها الإقليمي الدكتور أحمد المنظري ومكتبها القطري في السودان للدعم الفني المقدر الذي تستمر في تقديمه لشعب السودان في هذا الظرف الصعب. ونشكر كذلك الدول الأعضاء والمنظمات الإقليمية التي تستمر في دعم الشعب السوداني بالمال وبالأدوية لينال حقه في الصحة. إننا نتطلع بعد بيان الجيد للسيد المدير العام إلى اكتمال إصلاح منظمة الصحة العالمية لكي تلعب دورا فعالا في تطوير آليات الحوكمة الرشيدة والإدارة فيها وفي الدول الأعضاء. إضافة إلى ذلك فإننا نلتزم بتحقيق أهداف التنمية المستدامة في السودان. تحديدا يسعدنا خلال هذه ال6 أشهر الأولى من عمر حكومتنا المدنية الانتقالية في السودان أننا تمكنا بفضل الكوادر الصحية في السودان وقادة قطاعهم الصحي الجدد ودعم منظمة الصحة العالمية من إعلان السودان خاليا من وباء الكوليرا هذا العام الشهر الماضي، وذلك بعد 346 حالة فقط بالمقارنة مع 35,000 إبان وباء الكوليرا الأخير قبل عامين في عهد النظام البائد، وبعد 11 وفاة فقط بالمقارنة مع آلاف الوفيات في العهد البائد. يسرنا أيضا دعما لأهداف الصحة للجميع ولأهداف التنمية المستدامة لأننا قد تمكنا شهرا قبل الماضي من زيادة السعة التشغيلية لمرافق صحية كثيرة وزيادة الميزانية للصحة ب3 أضعاف، ونرجو أن يمكننا ذلك من تقليل سمتنا ووصمتنا بأن المصاريف الصحية out of pocket expenses المصاريف الصحية التي يدفعها المواطن بأننا في قاع ذلك الجدول عالميا، ونتمنى بذلك أن نبدأ مشوارنا لدعم منظمتكم وأهداف الدول الأعضاء. شكرا جزيلا.
Thank you very much. Next speaker is Singapore, followed by Argentina and Chile. So Singapore, floor is yours.
Thank you, Chair. First, Singapore would like to express our deepest condolences to Dr. Peter Salama. His passing is a great loss for WHO and the world. Pete was also a dear friend to Singapore. We remember him as a man who led by example and inspired others around him with his dedication and commitment to making the world a better place. Secondly, over the past few months, the 2019 novel coronavirus outbreak and the Ebola outbreak have gripped headlines all over the world. These outbreaks are a somber reminder of the importance of WHO's work in health emergencies. Singapore thanks WHO for providing leadership in global response towards outbreaks and in working with member states to increase capacities in pandemic preparedness and response. We also applaud China's transparency, timely sharing of information, as well as China's determination and efforts to contain the coronavirus spread. We have every confidence that China and other member states will work together to win this battle against this disease. With an increasing connected world, every country remains vulnerable to epidemics and emergencies, regardless of the maturity of their health systems. Thus, we must continue to invest in pandemic preparedness, increase the capability of our health systems, and forge stronger people-to-people linkages and enhance collaborations so that we can be more resilient against global health threats. With cities being major hubs of human activity, urban health preparedness in particular deserves our attention in such efforts. Lastly, Singapore commends Dr. Tedros and the Secretariat for the good work done in the past year towards achieving the triple billion goals. We are impressed by the progress made towards WHO transformation. We would also like to express our appreciation to DG for his leadership during this coronavirus crisis, and we totally concur with his call for solidarity. Thank you.
Thank you very much. Next speaker is Argentina, followed by Chile and Sri Lanka. Argentina, floor is yours.
Muchas gracias, señor presidente. Gracias, señor director general, por su reporte. El 10 de diciembre pasado, Argentina inició un nuevo gobierno y en este sentido el ministro de Salud de la Nación, el doctor Ginés González García, envía a través nuestro su compromiso para que durante su gestión nuestro país y la región de las Américas fortalezcan su rol, sinergizando y colaborando con la Organización Mundial de la Salud. En primer lugar, queríamos compartir las palabras de los representantes de las regiones de la OMS y expresar nuestras más sentidas condolencias por el fallecimiento del doctor Peter Salama, tanto a su familia como a sus compañeros de trabajo. Por otro lado, expresamos un inmenso reconocimiento y respeto para los colegas que están enfrentando la epidemia de ébola en la República Democrática del Congo por su valor y compromiso. También celebramos los logros claves alcanzados por la Organización Mundial de la Salud durante los últimos 12 meses, tanto en relación con las enfermedades, con las acciones programadas como en respuesta a las emergencias y los esfuerzos redoblados para lograr la erradicación de la poliomielitis, controlar los brotes de ébola en África y la reemergencia del sarampión. Sin dudas, el año 2020 nos encontrará en el mismo camino. Con respecto a la declaración de emergencia de salud pública de importancia internacional debido al brote de coronavirus, Argentina destaca el liderazgo y compromiso que ha mostrado la República Popular de China, la transparencia y los esfuerzos por investigar y contener el brote actual. Por otro lado, China ha implementado medidas de salud pública de una dimensión histórica que serán beneficiosas no solo para el país, sino para el resto del mundo. El liderazgo y la rectoría de la Organización Mundial de la Salud son de vital relevancia en esta instancia, generando recomendaciones sólidas, oportunas, considerando las realidades de todos los países, no solo en el ámbito sanitario, sino también en el inmenso desafío que implica la comunicación social en tiempos de crisis. Sin duda, la colaboración internacional, el acceso a la información transparente y oportuna y la solidaridad son el camino para contener este brote. Esta rectoría deberá contemplar también la puesta en marcha de medidas para garantizar el desarrollo rápido de vacunas, nuevos diagnósticos, tratamientos específicos y que los países de ingresos bajos y medianos tengan acceso a ellos en forma oportuna y equitativa. Esperamos que para este año que comienza se alcancen los logros, se emprendan nuevos desafíos y podamos transformar amenazas en oportunidades y aprovecharlas al máximo, Como expresó el presidente de la República Argentina, el doctor Alberto Fernández, es tiempo de comenzar con los más vulnerables para después llegar a todos. Muchas gracias, señor presidente.
Thank you very much. I have 5 more speakers. I will lead by, I would like to invite in the following order: Chile, Sri Lanka, Indonesia, Bangladesh, and Eswatini. And Israel again? In national capacity. Okay, so I will repeat by this order. Chile, Sri Lanka, Indonesia, Bangladesh, Eswatini, and Israel. And then I would like to close the list. The list is closed. Now may I invite Chile, followed by Sri Lanka and Indonesia. So Chile, floor is yours.
Muchas gracias, señor presidente. Muchas gracias al director general por su completo informe que nos ha entregado. Mi país quiere sumarse a las condolencias expresadas a la familia, a la organización y a los colegas por el lamentable fallecimiento del doctor Peter Salama y aprovechar de reconocer la dedicación, sacrificio y esfuerzo de todos los trabajadores de la salud en los diferentes rincones del mundo. También quisiéramos agradecer al Gobierno de China por la rapidez, compromiso y transparencia con que ha manejado la situación del coronavirus. Tenga la seguridad, señor presidente, que el Gobierno de Chile está tomando todas las medidas necesarias respecto de esta emergencia en particular. Señor presidente, hoy nuestras sociedades enfrentan nuevas amenazas, cambio climático, nuevas enfermedades, envejecimiento de nuestras poblaciones y nuestros ciudadanos nos exigen soluciones inmediatas. Hoy la salud pública no puede esperar y debemos focalizar nuestro esfuerzo, nuestro trabajo en áreas con impacto directo en las personas. Por lo anterior, y considerando la agenda de trabajo propuesta, nuestras autoridades de salud han identificado las siguientes áreas de trabajo como prioritarias. El pilar 1, cobertura sanitaria universal para 1.000 millones más de personas. En este contexto debemos avanzar juntos para construir un mundo más sano y Chile está lanzando un proceso de reforma en el sistema de salud y ve en esto una oportunidad para generar mejoras. Hoy debemos trabajar para alcanzar la cobertura al mayor número de personas, pero sin olvidar la calidad del servicio que entregamos. Pilar 3, mejor salud y bienestar para 1.000 millones de personas. Queremos participar activamente en el diseño de envejecimiento saludable. Hoy muchas de nuestras sociedades están en un proceso de envejecimiento y debemos preocuparnos para que nuestros adultos mayores tengan una sana y buena calidad de vida, lo que implica tener una visión integral de esta realidad. Dentro del concepto de salud y bienestar, también resulta relevante que trabajemos por acelerar los esfuerzos en relación a la inocuidad de los alimentos, como también incorporar las nuevas tecnologías en beneficio de todos con un proyecto de estrategia global sobre salud digital. Muchas gracias, señor presidente.
Thank you, Chile. Next speaker is Sri Lanka, followed by Indonesia. Sri Lanka, floor is yours.
Chair, Director General of WHO, members of Executive Board, ladies and gentlemen. Let me take this opportunity to thank all who have continued to have confidence in Minister of Health, Sri Lanka. Thank you for appointing me, thus enabling me, Sri Lanka, in continuing the membership as a Vice Chair. We are indeed deeply saddened by loss of Dr. Peter Salama, Executive Director of Universal Health Coverage Life Course. We would like to offer our condolence to his family, and Chair, may we suggest that a special session on the sidelines of WHA acknowledging his contribution to global health. Sri Lanka expresses its solidarity with People's Republic of China at the coronavirus outbreak and values the measures taken by China and stewardship of DG WHO and swift action taken by WHO. Pavitra Vanniyarachchi, Minister of Health, Indigenous Medical Services of Sri Lanka, conveys that she is unable to attend the board, although she had planned to, due to matters of urgency that she has to remain in Sri Lanka. She conveys that under the new president of the government's commitment to universal health coverage, primary care strengthening, addressing non-communicable diseases will be further strengthened and greater emphasis will be given to policies aligned with health promotion and prevention. As the member of the delegation representing Minister of Health, I wish to thank DG Dr. Tedros for his address capturing the recent and ongoing developments in the transformation agenda of WHO. We are very happy for WHO
pre-qualification of trastuzumab biosimilar, as these drugs drain a lot of resources. We expect WHO to pre-qualify more and more medicines so that countries could depend on this for procurement. During 2019, whilst we moved forward with primary care reforms in Sri Lanka, the need to address shortages of human resources in health needs mentioned. As our region continues to expand services for maternal and child health and has to focus on aging population, address the required skill mix need special attention. Chair, in addition to chronic non-communicable diseases in Sri Lanka, we also face the challenges of chronic renal diseases of uncertain etiology. WHO support was extended more than a decade ago for a baseline research into the etiology, but remained inconclusive. In conclusion, we appreciate the leadership of the Director General of WHO and also the Regional Director of Southeast Asia region for guiding us to move closer to achieve universal health coverage. Thank you.
Thank you very much. Next speaker is Indonesia, followed by Bangladesh and Eswatini. So Indonesia, floor is yours.
Mr. Chairman, as all the delegates have voiced before me, Indonesia is deeply concerned with the alarming global outbreak of the novel coronavirus. Indonesia fully supports the decision by the WHO to declare the novel coronavirus as a public health emergency of international concern. We appreciate the cooperation and guidance the WHO has given us, in particular for the effective and efficient process of the evacuation and containment of our own national from Wuhan. We would also like to commend the government of the People's Republic of China for the cooperation and action in containing the outbreaks. We rely on the WHO expertise to lead us out from this health crisis. Mr. Chairman, Indonesia would also like to thank Dr. Tedros and the WHO Secretariat for the information provided on the WHO transformation. We congratulate the WHO for undergoing long and extensive transformation for the betterment of the organization. We hope that with the completion of the transformation process, WHO can now focus on implementing and conducting programs to achieve its ambition as reflected both under the Global Program of Work 13 as well as SDGs Goal 3. We also hope that the WHO transformation undertaken will not only have positive impact with WHO headquarters, but also at the regional and, more importantly, at national level. We believe a wider mandate to country office would enable the WHO country office to be more active and responsive to the needs of each country. Thank you.
Thank you, Mr. Chair. On the untimely demise of Dr. Salama, there is not much really to add than what I did in writing to Tedros in a few days back. We fully join others in condoling his death. May his departed soul rest in peace. We thank the DG for his report, particularly for its candor and comprehensiveness, touching upon unprecedented challenges, achievements, and transformation in key areas of global health, including the outbreak of the novel coronavirus. We again today take this opportunity to appreciate the tremendous efforts and political commitment of the government of China, including at the very highest level in containing the outbreak and preventing further spread in collaboration with WHO. Let me also express our deep appreciation for WHO and its staff for the prompt and timely engagement so far towards addressing the severe public health concern. All will agree perhaps that with the most recent death outside China, there is concern about the virus's spread to countries with weaker health systems. We believe WHO and others who are in a position to do so should provide intensified support for preparation and response, particularly in vulnerable countries and regions. We further call upon WHO to duly implement a comprehensive risk communication strategy, timely and transparent review of the situation, and update its evidence-based recommendations. As last year was one of many emergencies, including the one that is continuing in our country, that is the situation of the forcibly displaced Myanmar nationals. About 1.1 million of them are housed there. We have done our best. We commend DG's personal engagement and leadership in rolling out actions aimed at providing required health services to the Rohingya population and to support the government of Bangladesh. Given the continued precarious situation, it is expected DG's report to reflect their health needs as and when possible. To conclude, Mr. Chair, we recommit to achieving the universal health coverage, ensuring quality health care for all, and as envisaged in the 2030 agenda. We must also make sure that the mental health as a part of the UHC is given more importance accordingly, and Bangladesh is happy to be one of the 12 priority countries of the WHO Special Initiative for Mental Health. We look forward to working with WHO and the other partners in promoting mental health further while attaining UHC. Thank you all.
Thank you very much, Bangladesh. Our next speaker is Eswatini, and then followed by last speaker of Israel. So, Eswatini, the floor is yours.
Thank you very much, Mr. Chairman. First and foremost, we would like to express our condolences to the people of China for the lives lost to the novel coronavirus outbreak, and to Dr. Peter Salama's family, friends, and colleagues on his untimely passing. Mr. Chairman, while we commend the WHO and the government of China for the work done in containing the outbreak of the coronavirus, the Kingdom of Eswatini is concerned about the observation that the global health landscape remains inadequately covered from epidemics. And the Director General mentioned this in his speech. We note that this, in part, is due to political conflicts or interference to some independent states and to WHO. One example is the Republic of China, Taiwan, that has limited access, if any, to the WHO IHR processes. Taiwan's technical experts are of late denied participation in technical meetings of the WHO. This, unfortunately, leaves over 23 million people of Taiwan and others vulnerable to such epidemics. Yet we know that Taiwan has cutting-edge expertise that would benefit all of us. A case in point is the management of the current novel coronavirus outbreak, where inaccurate information and listing was shared, leading to unfortunately misplaced decisions impacting negatively to the people of Taiwan.
Stop. China, are you going to make point of order or like to reply? Which you would like to demand? Point of order. Please go ahead.
主席先生，刚才有代表利用这个讲坛大肆的炒作涉台问题，纯属出于政治动机，既严重违反联合国宪章和世卫组织法的宗旨和原则，以及联大、世卫大会的有关决议，又偏离了会议的主题，违反议事规则。中方谨请主席提醒有关国家停止发表不负责任的言论。中国代表团也会在今天上午会议结束前行使答辩权，进一步阐述他所谈及的有关问题的立场。谢谢。
You would like to do the same. Thank you very much, China. I think I heard that your points, and it seems that I'd like to reply. But in the future, I would like to request all board members to focus on technical issues in front of us. Okay, so our last speaker is Israel.
Well, thank you, Director General, and thank you, Chair. We appreciate your report and all your work together with the Deputy Director General, senior management, and all of the dedicated staff of WHO. We would like to send our sincere condolences to Dr. Salama's family, colleagues, and friends. We value his contribution to improving the health condition in our region and are honored to have hosted him in Israel on several occasions. We would like to voice our support of your efforts to bring transformation process to its successful conclusion and the statement made by Australia on behalf of a group of countries. We value the increased focus on impact at the country level and on strengthening country office capacities as we look forward to the opening of a country office in Israel. We are confident that through the newly established office, we will enhance further cooperation and our contribution to a variety of WHO programs regionally and globally. At the same time, we would like to emphasize the importance of the normative and standard settings of work of WHO. We appreciate the efforts being made at all three levels of organization to face growing global health challenges, especially WHO's global leadership facing outbreaks and other emergencies while maintaining a well-governed organization. Thank you.
Thank you very much for your contribution. I think I'd like to come back to China's points. And I still understand that you would like to exercise right to reply. That will be granted according to the rule of procedure at the end of this meeting. So in other words, you will be the last speaker in this morning. But I'm afraid to say that that should be crisp and short. And usually it is 1.5 minutes. That is a practice which was advised by legal counsel. So, but your right to reply is guaranteed at the end of this meeting. Eswatini.
Thank you, Chair. Just for your indulgence, I had not finished reading my statement when you stopped me. Thank you.
Okay. Okay. In that case, first, let me clarify. China's right to reply is guaranteed. And Eswatini is saying that, well, his statement is not completed. But within, I think, 2 minutes already, I think you have heard 1 minute. So I think I can give 1 minute to conclude. Thank you, Eswatini, for collaboration. Go ahead. Eswatini, if you would like to speak for under 1 minute, you can now.
Thank you, Mr. Chairman. The remainder of my statement reads thus: Mr. Chairman, the global health community needs to address this and discourage such tendencies as they negate the work that we do to protect our people. The Kingdom of Eswatini remains committed to global health solidarity and collaboration to combat any disease epidemic. I thank you.
So China, I think, a right of reply will be at the end of this morning. Thank you. Now, I'd like to open floor for non-EB member states. So please raise placard. But you will be reminded that already group statement, as if a group statement include your components, please focus on other elements. So Secretariat is noting, so please. So far, can you list all? So in order to save time, I think I would give, I recognize at least 5 speakers: Paraguay, Mexico, Cote d'Ivoire, South Africa, United Kingdom, Thailand, Switzerland, Netherlands,